am Dr. Lakshmi Chaitanya, Consultant Neurologist at SLG Hospitals. Today I am going to discuss about stroke in layman's language, so that by the end of this video you are all sure how to act exactly when you face a stroke. So why is it so important to know about stroke? Stroke is very common. One stroke happens every 40 seconds in India. Stroke can cause severe disability, even death. One stroke related death occurs every 4 minutes in our country. And there are effective treatments which, when given in time, will protect us and save our brain when stroke occurs. If given early, the treatment gives a significant better outcome. So now, what is stroke? Stroke is brain attack. Here, a blood vessel which supplies to the brain gets blocked suddenly by a clot, or the blood vessel may rupture. When this happens, the part of the brain which is supplied by this blood vessel stops functioning, and within minutes the brain cells start to die. Almost 1.9 million brain cells die every minute right from the beginning of the stroke. So the early we intervene, the earlier the treatment is given, we can save these many number of brain cells which are dying every minute. So it's very important to recognize the stroke and act promptly. So how do I identify? As a common person, in order to identify stroke, just remember the mnemonic B FAST. B-E-F-A-S-T. B for balance, sudden onset imbalance, difficulty in walking. E for eyes, sudden onset visual disturbances or double vision. F for face, sudden onset numbness or weakness in one side of the face with facial deviation. A for arm, sudden onset numbness or weakness of one arm or a leg. S for speech, sudden onset speech disturbances, difficulty in understanding, talking. So basically all these symptoms present suddenly in stroke. If you can identify any of these symptoms, then there is a high chance that a patient is suffering from stroke. At last, T, it is time to act, time to react. So now, after identifying stroke, what can I do? What can I do to save my brain? You have to call immediately. Take a phone and call an ambulance, or rush to a nearby hospital. Rush to a center where at least a CT scan facility is available and neurological services are available. Any center with a CT scan facility and neurologist service can potentially thrombolize and save your brain. What are you going to expect in the hospital? Once you reach the hospital, basically you will be evaluated by a doctor. Some blood tests will be ordered, and then you will be taken to a CT scan where CT brain is done. And once the doctor feels that you are eligible, you will be given a clot bursting drug. This drug, literally, it bursts the clot which is obstructing the blood vessel, and it re-establishes the blood supply to the brain, and thus you can save a lot of brain cells from getting damaged, from dying. So if we can recognize the stroke promptly and act fast, we can save lives. So the take home message is stroke is emergency. Be fast. B-E-F-A-S-T. Any sudden onset imbalance, visual disturbances, weakness, numbness of one side of face, arm, leg, or speech disturbances, it is the time to act. Take a phone, call emergency, and rush to a nearby emergency center, preferably a stroke ready center with CT scan facility and neurologist facility. The symptoms of brain stroke are, all the symptoms most importantly are sudden in onset, and any part of your body can be affected. Let us start from head. There can be sudden onset visual disturbances like visual blurring or double vision. There can be sudden onset giddiness, headache, sudden onset deviation of face or weakness of face, or a part of your the body like hand or leg may stop to function. There might be weakness or numbness, and there can be trouble seeing, trouble speaking, trouble walking. So basically any part of your body can be affected which is supplied by the brain, which is controlled by the brain, and it presents suddenly. So in order to remember it for a common person, it's better you remember FAST, fast. F for face, A for arm, S for speech, and T is time to act.